And now, Wellness Wednesday is sponsored by Gladstone Psychiatry and Wellness. Care that meets you where you are.
In today's Wellness Wednesday, we are joined by Greg Franklin from Gladstone Psychiatry and Wellness.
And we're talking about breaking the stigma, addiction as a mental health concern. Greg, thank you for joining us again.
Yeah, thank you. Thank you, Tim. Thank you.
Yes, this is a heavy topic, lots of layers on this. So from a mental health perspective, you said you dealt with this for many, many years, or on the other side, helping people. What should we really be thinking about when it comes to addiction?
What I often try to help people understand is to think about it medically and not morally, because a lot of people think it is a moral failing when somebody is struggling with addiction. And thinking it in that terms, like you wouldn't judge somebody who is experiencing high blood pressure or diabetes. You would encourage them to talk to their doctor, maybe change some eating habits or exercise habits, but you wouldn't judge them for struggling with those things in the first place.
Is that one of the biggest misconceptions? You talk about the misconceptions of addiction. Is that one of the things that people just kind of put out there and then they just kind of act based on that maybe misinformation?
Yeah, a lot of people think of it in terms of choice, and people aren't choosing to have these kind of struggles in their lives. If everybody was put in front of them, just say like, oh, would I love to do this? No, that's not how most people want to spend their time, their money, their energy. They don't want to be hurting their families. And looking at it in terms of medically, where there are things going on, people might have genetic predispositions or other factors, mental health disorders that are co-occurring and exacerbate some of those symptoms as well.
Yeah. And so when you hear the word addiction, like you said, it could range from drugs, alcohol, gambling, and there's so many things, but there's always a stigma and it's always negative. How do you push through that stigma to where you're like, okay, I need that help. I need to get to the other side?
I think a lot of it comes down to education and learning about what that is, whether it's somebody struggling with addiction or the loved ones and family members who are struggling with addiction. Breaking that stigma, information is one of the biggest pieces, and going to places where there are supports. There are all kinds of supports out there, from Al-Anon, Alcoholics Anonymous, smart groups. Those are some really easy to access, but there's also places like Gladstone that offer therapy where there's a lot of education around that. Other programs will do that. One of the things Gladstone is actually launching is outpatient level addiction support, where people who aren't ready to commit to the more intensive outpatient models or inpatient, where they can get support and care, and as well as information as well, so that way they can learn what they can do and what they can't do.
Wow. And you talked about, we were talking in a commercial break about things, people may sometimes have a false sense of security about some things. Maybe I stop smoking, but I go to vaping. Maybe I don't do medical marijuana, but I go to THC gummies. You know, there's sometimes you can go from one thing to another, and it may not necessarily be as beneficial.
Yeah, not all things are as harmful, and not all things are necessarily beneficial or more safe. I often try and bring it back to a terms of what people can do. There are a lot of medications that can be abused, but there are also, whether it's prescription or otherwise, but finding those resources where you can essentially manage cravings. There's a lot of medications like Vivitrol, naltrexone, Antabuse that help people manage cravings, for example, or otherwise block those receptors that will encourage somebody to continue with it. But again, it is also helpful to have that with therapeutic settings where there is behavior change associated with that.
Yeah, and speaking on that a little bit, but what are some of those common signs that you notice and you're like, okay, I need to seek treatment for addiction, or how can family and friends help with that?
Yeah, usually we're looking at things whether certain behaviors are getting out of control. A lot of times, a family member will say, oh, I want my spouse and partner to come into treatment because I feel like they're drinking too much. And the first questions are always going to be, what's too much? What are you actually doing? So there's different models in treatment. There's abstinence-based models where somebody is expected to completely stop. And there are harm reduction models, which I generally prefer because it meets people where they're at. So they can say, okay, well, how much are you drinking? How much do you want to be drinking? We often operate from the space of stages of change, where we are trying to help identify how ready is somebody to make that change. If they want to cut their drinking from a 6-pack a day down to 1 a day or not at all. What are the health concerns? So everybody's going to approach it from a different space, and having that information is going to be helpful, but having a safe place to talk it through and recognize this is okay to have this conversation. That's why groups are such a powerful intervention.
And to your point, we've had it up on the screen, but folks reaching out to you, GladstonePsych.com is the place, the first step.
Yep, and if somebody is having more intensive spaces, there are places all around the area like Ashley Addiction Treatment, Mark, and Colmac. They all provide different levels of care. And like I said, at Gladstone, we have prescribers that will help people with mental health, and we're also approaching with this new outpatient level groups.
Such an important topic. Thank you for joining and sharing your insight.
Thank you so much.
Thank you.
Wellness Wednesday on WJZ at 9 is sponsored by Gladstone Psychiatry and Wellness. Care that meets you where you are.